Hey everyone, this is Dr. Qazi, and in this video, we are going to learn about what is drug distribution and what are the factors affecting the drug distribution. When the drug reversibly leaves your bloodstream and enter the interstitium or the extracellular part, this is known as the drug distribution. Have a look at this diagram. We know that we can give the drug to various routes of administration, like you inject the drug into your intravenous circulation, the intraventricular route or the intradermal route, or you can take the drug to nasal or the oral inhalation. Now, all of these routes of administration will eventually deliver the drug to your blood capillaries or your bloodstream or your systemic circulation. Now, through this systemic circulation, the blood will be distributed to your tissues, to your organs, and the extracellular part which is between the cell. This is what the drug distribution is, from the bloodstream to your interstitium and the cells. Now, there are certain factors which affect the drug distribution, like the cardiac output or simply the blood flow, the capillary permeability, the drug binding, and the lipophilicity. Let's discuss this one by one. We know that certain organs receive the greater amount of blood flow as comparison to the other, like the brain, liver, and the kidney. They receive the huge amount of blood flow as comparison to your skeletal muscle, your viscera, your skin, your adipose tissue. So the organs which receive the greater amount of blood flow, the drug distribution will be great as comparison to the other organs in which you have the reduced amount of blood flow. Now, you induce hypnosis in a patient or you induce anesthesia by injecting the propofol. It's a drug. You inject it through the IV bolus in order to induce hypnosis or anesthesia in a patient. Now, due to greater amount of blood flow to your central nervous system, the propofol drug will be rapidly distributed into your central nervous system. But after some time, the consciousness is regained. Have a look at how consciousness is regained after injecting the propofol. Now, through the bloodstream, the drug will be deposited or slowly distributed in your skeletal muscles and in your adipose tissues. So the concentration of drug in your bloodstream is decreasing, and when the concentration of drug is decreased to a significant level, the consciousness is regained. The capillary permeability affects drug distribution because there are three types of capillaries: the continuous capillaries, the fenestrated capillaries, and the discontinuous capillaries. We know that the capillary consists of the lumen, and outside of the lumen we have endothelial cells, and outside of the endothelial cells we have the basement membrane. Some kind of capillaries have no spaces between these endothelial cells, so they have tight junction. Some kind of capillaries have little spaces between the endothelial cells. We call them the fenestrated type of capillaries. And some other have a lot of space between the endothelial cell and their basement membrane. It's fragmented, so we call them the discontinuous capillaries. Now, these type of capillaries will affect the drug distribution. How? Because the variable fraction of the basement membrane is exposed by the slit junction and the tight junction. Let's have a look at it. In case of your liver and spleen, you have the discontinuous capillaries. So there is a space present between these endothelial cells. The endothelial cells I have shown with the red color and the basement membrane with the green color. Now, the significant portion of the basement membrane is exposed in case of your liver and spleen because of the discontinuous capillaries. So, the large protein particles and the drug will be passed from this lumen and cross these slit junction and distributed to the tissues and the cell present around these capillaries. In case of your brain, you have the continuous capillaries, tight junctions between these red color endothelial cells. The drug cannot pass through this tight junction. The drug has to cross through the endothelial cell. So we have special transporters which will take the drug from the lumen through the endothelial cell, and they will reach these astrocyte for processes in case of brain. So it will affect the drug distribution. The lipid-soluble drug easily pass through the endothelial cell and the basement membrane. Why? Because they are lipid soluble. The cell membrane is also lipid in nature, so like attracts like, no problem crossing the cell membrane. The ionized don't cross through the cell membrane. There is one basic rule of drug absorption and drug distribution. It is always passed through the membrane in neutral form. The charged form cannot cross. So the ionized cannot pass through the endothelial cells to reach the target tissues. Now, the drug which is flowing through your capillaries, through your bloodstream, inside your blood, the drug binds with the special plasma proteins known as the albumin. Have a look. The blood is flowing through the bloodstream and it binds with this green color plasma protein. These plasma proteins act as the reservoir. When the concentration of the drug in your bloodstream is decreased, the bound form is released in order to maintain the constant fraction of the drug in your circulation. Just like the plasma proteins, the tissue can also act as the drug reservoir. How? Because in the tissues we have the protein, nucleic acid, so the drug will bind to the tissue's protein and the nucleic acid and act as a reservoir. In certain diseases like the hemorrhagic cystitis, the metabolites are accumulated in your urinary bladder, like the acrolein metabolite, which is the metabolite of the cyclophosphamide drug. It accumulates in your bladder and cause hemorrhagic cystitis. This was all about the drug distribution and the factors affecting drug distribution. Please do like, share and subscribe, and I will see you in the next video.